Naloxone 4 mg per actuation nasal spray. Opioid antagonists is used for the emergency treatment of known or suspected opioid overdose. This medication is used when someone has serious overdose symptoms such as unusual sleepiness, difficulty waking up, or breathing problems. Symptoms may also include small, pinpoint, pupils, slow heartbeat, or low blood pressure. It works by blocking the effects of the opioid in the brain. If you are not sure if the symptoms are due to opioid overdose, give naloxone right away anyway, since lasting slow/shallow breathing may cause permanent damage to the brain or death. Since symptoms of opioid overdose may return after treatment, be sure to get medical help right away after giving the first dose of naloxone. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. When you receive this medication, make sure to read the patient information leaflet and instructions for use provided by your pharmacist. Keep the medication handy in case it is needed and learn how to properly give it. If you have any questions, ask your doctor or pharmacist. It's important for close family and household members to know the symptoms of an opioid overdose and be instructed on how to give naloxone if needed. Opioid overdose should be treated right away to prevent serious effects such as brain damage. When using the naloxone spray, remove it from the package only when you are ready to use it. Lay the person on their back, tilt their head back, and support their neck with your hand. Gently insert the tip of the spray nozzle into one nostril, then firmly press the plunger to give the dose. Remove the spray nozzle from the nostril and move the person onto their side as directed by the manufacturer. The effects of this medication are rapid but not long-lasting. After giving naloxone, get medical help right away, even if the person wakes up. If symptoms return after giving the spray, give another dose in the other nostril every 2 to 3 minutes, changing nostrils with each dose. Each spray contains only one dose and cannot be reused. Continue to closely watch the person until emergency help comes and inform the healthcare professional that you have given naloxone spray. When using naloxone nasal spray, you may experience nasal dryness, swelling, or a stuffy nose. You could also have muscle or joint pain, or a headache. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they believe that the benefits to you outweigh the potential risks of side effects. Many people who use naloxone nasal spray do not experience serious side effects. If someone has been using opioids regularly, withdrawal symptoms can occur suddenly after using naloxone. These symptoms may include body aches, fever, sweating, watery eyes, runny nose, sneezing, goosebumps, yawning, weakness, trembling, nervousness, restlessness, diarrhea, nausea or vomiting, stomach cramps, increased blood pressure, and a fast heartbeat. In babies younger than 4 weeks who have been regularly using opioids, sudden opioid withdrawal can be life-threatening if not treated properly. Symptoms in babies may include seizures, excessive crying, and muscle twitching or spasms. While it is rare, a very serious allergic reaction to naloxone can occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you experience any other effects not listed here, be sure to contact your doctor or pharmacist. If you are in the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using naloxone, it's important to let your doctor or pharmacist know if you have any allergies to it or any other substances. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. Before starting naloxone, make sure to inform your doctor or pharmacist about your medical history, especially if you have any heart problems such as irregular heartbeat or previous heart attack. If you are planning to have surgery, make sure to let your doctor or dentist know about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to know that untreated opioid overdose can harm both you and your unborn baby. Naloxone may be used during pregnancy, but it could also cause opioid withdrawal in your unborn baby. It's important to tell your doctor right away if you have used this medication, so that you and your unborn baby can be monitored closely. Be sure to ask your doctor for more details. It's not known if naloxone passes into breast milk, but it is unlikely to harm a nursing infant. It's best to consult with your doctor before breastfeeding. When taking naloxone 4 mg per actuation nasal spray opioid antagonists, it's important to be aware of potential drug interactions that could affect how this medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without the approval of your doctor. This will help ensure the safe and effective use of naloxone nasal spray. Always consult with your healthcare provider for specific guidance on the best time to take this medication and the appropriate daily dosage for your individual needs. If someone has overdosed on opioids and is showing serious symptoms such as passing out or trouble breathing, it is important to call for emergency medical assistance right away. This can be done by calling 911 or contacting a poison control center for immediate guidance. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canada residents can reach out to a provincial poison control center for assistance. It's crucial to act quickly in these situations to ensure the person receives the necessary medical attention. It's important to talk to your doctor or pharmacist about how to prevent opioid overdose. Make sure to educate your close family or household members about the signs and symptoms of an opioid overdose and let them know where you store this medication. This medication can reverse the effects of an opioid overdose and it is used for emergency treatment in adults and children. The usual dose is 1 spray into 1 nostril. It can be repeated if necessary. This medication may be given every 2 to 3 minutes until emergency medical help arrives. It is best to use this medication as soon as you notice the signs of an opioid overdose. Naloxone 4 mg per actuation nasal spray opioid antagonists is used for the emergency treatment of known or suspected opioid overdose, as manifested by respiratory and/or central nervous system depression. It is intended for immediate administration as emergency therapy in settings where opioids may be present. The recommended initial dose of naloxone 4 mg per actuation nasal spray opioid antagonists is 4 mg, 1 spray in 1 nostril. Additional doses may be administered every 2 to 3 minutes if the patient has not responded. The best time to take this medication is when someone is suspected of having an opioid overdose. It is important to follow the instructions and receive proper training on how to use this medication in emergency situations. When it comes to storing naloxone 4 mg per actuation nasal spray opioid antagonists, it's important to keep it in the original package at room temperature away from light and moisture. Make sure not to freeze it or store it in the bathroom, and always keep medications out of reach of children and pets. It's also crucial to check the expiration date from time to time and replace the spray before it expires. When it comes to getting rid of the medication, it's important to properly discard it when it's expired or no longer needed. Be sure to consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.